Welcome back on Dental TV. As always on YouTube, we start with hit the subscribe button. I know this is the hook. The hook on YouTube is hit the subscribe button. On other social media, you should start with talking about problems and whatever. But today we will not talking about problems. We will talk about how to solve problems. And my great pleasure to have Avi Patel here with me, the aligner coach, the aligner guru or influencer, whatever you are called. And maybe you introduce yourself and tell me, why did you jump on? We have trendy topics in dentistry. One is implant dentistry. Basically, trendy topics are correlated with potential income for the dentist. So if we talk about prevention, then you say, yeah, I know prevention is important, but yeah, how do I make money out of it? And then if we start, or even talking about dental photography, yeah, it's interesting, I know, but how can I make money out of it? It's like an extra service. I'm not able to charge that much. But if we talk about implants, aligners, veneers, and all this stuff, then the ears of dentists are opening up. It's like I had a discussion with a guy owning a big dental company, and he was asking me, why or how can we approach dentists better, and say, look, the best approach to a dentist is not, hey Avi, I know the secret how you can become a better dentist. They say, yeah, okay. And if I just change the phrase, say, Avi, I know the secret how you can make a lot of money, then tell me more, tell me more. But I think you are mixing it up, helping dentists to be more efficient, to have more fun in their job, especially today in a world where everybody's talking about mental health issues, about all this stuff. I think we live in an interesting world. We have a lot of options. And I like people like you that are motivating us to look forward, to do something. But okay, let's stop talking. I give the word to you. Please introduce yourself and tell me, where in your career did you start to have the idea to do what you're doing now?
Yeah, no, I appreciate it. I mean, there's a lot to unpack there that I'm excited for us to get into, but just to give a little bit of backstory and then we can kind of go from there. I'm Dr. Avi Patel, general dentist. I I think the most important place to start is the beginning. Like, why did I choose to be a dentist, right? What was my thing? So growing up, I actually, in middle school, I was convinced that I was going to be in the NBA. I was 5'10". Kobe Bryant was my favorite player in the world, and I thought I'm really good at this sport. I like it. There's no way I'm not going to the NBA. And then I go into high school, and all of a sudden, I go from the tallest kid to one of the, not like one of the shortest. All my friends had grown like 6, 8 inches. It seemed like over one summer, and then that's when I realized I don't think I'm actually that good. So at that point, my parents were like, "Look, look into something where you can use your brain, right? You're Indian, your genetics are going to limit you to some degree, so like use your brain, you're going to have more longevity." I'm like, okay, fine. So I'm looking around, I'm looking for inspiration, and one of my uncles, he anytime I had been around him, he was always in a good mood. He was very good energy, he was living a good life, he was traveling, he always had like a nice car. He was golfing, throughout the week, and I'm like, "What does this guy do?" He's a dentist. So I shadowed him in high school, and I just saw the way he was living. I saw how he was treating his patients, how his patients were looking to him, and I was like, "You know what? This is really cool." And then at his dinner party that he had that night, one of his buddies was there as well, and he was a neurosurgeon, and he's talking to me. He's like, "Hey, what do you want to be when you grow up?" All this kind of stuff. And then, at that point, it was between medical school or dental school. And then after a while, I was talking, and I'm like, "Hey, by the way, like, why are you spending so much time talking to me and not hanging out with all your friends who are partying over there?" And he's like, "Oh, I'm on call." And it was a Friday night, and I was like, "Yeah, I don't know if I want to ever be on call on a Friday when I'm older." So that's what kind of pushed me into dentistry. But it was the three buckets of profession where you can have time, make money, and feel fulfilled by helping people, right? So those are the three things that pulled me in. I go to dental school, I come out the exact opposite. I'm not making money. I've got student debt. I'm working 6 days a week. I'm just drilling and filling. It doesn't feel like I'm making a difference. And so that started to weigh on me. But I was always this person of trying to just improve, right? Okay, this is my reality. What can I do to improve this? And so then I started to look, for the basic stuff, get better at crowns, bread and butter. And then I reached a point where I started to just burn out on that. And I'm like, man, and this was only 2 years in. So I was like, geez, like, this is not how I envisioned this career. And then so that's when I decided to invest in myself and level up in implants and aligners. And so I had a mentor for aligners, implants. I took a pretty extensive course, implemented both. My wife and I at that point moved across the country from New York to Texas. And the group that I was at, they were very supportive of continuing education. They're like, yes, we support you. Whatever you want to do, do. Here's a scanner, here's an implant system, go for it. So then basically with aligners to my mentor, I was like, hey, can you just teach me what is predictable, what is easy and simple, and what should I absolutely not do? And so by just taking something that was so unknown, because none of us were taught how to do aligners, and simplifying it that way, I was able to take that and then go implement it. And so again, like the whole workflow and all that was stuff that I had to figure out, but I kept trying and I started helping patients and getting things moving. Started 50 cases in my first 6 months. I didn't think that was a big deal, but all these the reps started coming in like, hey, you're doing a lot of cases. What are you doing? What's going on? This isn't normal. And so at that point, that's when I realized I'm like, oh, okay, like maybe what I'm doing is a little bit different, but it was awesome because at that point I made more money than I'd ever made as a dentist. I was helping more patients through a transformation. And I didn't have to be like stuck in the chair so much because, with aligners, it's very minimal labor. So, one of the dentists I was working with at the time, he was older, had about 25 years more experience than I did, and he was like, "Hey, I don't understand." I'm like, "What do you mean?" He's like, "You're producing like $100,000 months, and you are barely on the clinic floor. You're always on your computer. What are you doing?" And I'm like, "Oh, I'm doing aligners and I'm setting up the cases, and that's pretty much it." So he's just like, "Can you teach me how to do that?" And I was like, "Yeah, I'll teach you." So that was the first person who I got to basically mentor on this, and I really liked it. It activated a different part of my brain. So I am the oldest of three. So naturally, I'm always wanting to give advice and help, right? My younger siblings. Problem is my siblings don't ever want to hear that advice. So I never get to, you can say naturally that is right. That's who I am. And so at the time, I was also like seeing a therapist just for personal development, improving mental health, all that stuff. And she was like, "Look," she's like, It's not about you, the advice you're giving." She's like, "It's just maybe the people who you're giving it to." So that's where I was able to channel all this into helping other dentists, right? With tips and whatnot. So at that time, I was looking to continue to like mentor and teach. The group I was at, I asked them, "Hey, you guys have 30 offices. Can I do this? This could be a win-win for everybody. Maybe I work one less clinical day. I do a little bit more of this coaching." And they're like, "No, no, you, basically in a very nice way, they were like, "You're too young and no one's gonna listen to you." And so I was like, okay. I've done the most cases out of all the doctors here, so I don't see how that makes any sense, but sure." So then my wife was like, "Hey, you're pretty passionate about this. Why don't you just go start doing this on your own? Like some coaching and consulting on your own." I'm like, "Okay. I didn't know I could do that, but let's give it a try." So I started working in person and doing one-on-one, and that's when I started posting on social media. And so, I had read this book, my mom gave it to me, The 10X Rule by Grant Cardone. And so he talks about setting goals that are 10 times bigger than what you initially think, and then taking massive action to be able to reach those goals, right? So I started to get fascinated with this idea in the book also of omnipresence, which is showing up everywhere all the time. And one way to do that is through social media, and it costs $0, right? So I started to do that. I started to just share aligner tips. Hey, this is what's working for me. These are some common problems, the whole thing. And I started to like that. That started to get a lot of interest. And then basically, instead of doing the consulting thing, we packaged it into an online course. And then from there was able to help doctors, right? Free on social media or paid through our programs. And then that allowed for me to, at that point, I felt a pull in the direction of anytime I was able to work on the education side, I was a lot more excited, a lot more just a part of me was just lit up, where the practicing, it's not that I didn't like practicing, it was totally fine. But for me, I just was, there was a very stark difference, and it's almost felt like I was called to do this and I needed to do it. So I wanted to pursue more of it. And so, being able to dedicate more time and focusing on that has allowed for us to now, we've helped over 250 doctors get started with aligners through our programs, and now that is what I'm able to focus on, and it's yeah, it's been a lot of fun. And I to answer your question, the second piece of, did you see yourself getting to where you're at today? The answer is absolutely not. I did not know that this was possible. I did not know this is where I would be. But it has been something where, as certain doors are opening, even if it doesn't seem like it was according to plan, like I kind of am just trusting that, if it feels good and it's what I want to do, I kind of pursue it. So that's where we're at today.
So let's go back to the point where you were saying your colleague was telling you you're sitting on your computer and then you answered, yeah, I'm planning cases. What? So you told me, yeah, you did programs and aligner education. So basically, I know that there are, beside Invisalign, that's why we call aligners, is from the Align company, obviously. Now there are hundreds or maybe thousands of copies since the patent was gone.
Yep.
So you're in the US. So basically, where did you learn aligners? Or is it from your side? Now you're an aligner coach. If somebody is talking about aligners, where should I start? I'm doing aligners, but I'm in Switzerland. It's not that huge business as it is in the US. We do some cases, and we see there are different concepts, different strategies. It's getting closer to each other. So I see that the development, everybody's using attachments, so the strategies are getting closer to each other. But what was like the most important learning learning experience you had? Because something had to be different from the education you got to the education other doctors got, that you started being more successful? Was it like a brain thing, or did you think differently, or what was this initial phase? I'm pointing on the initial phase
Yeah.
between finishing dental school, the first 2 years, the frustrations you had, the aha feeling, saying, okay, I want to focus on implants and aligners, and then the setting the focus on this aligner thing. Maybe you can be a little bit more, give us some details on this part of your story.
Yeah, totally. So I think for me, it was a lot. There's like the Tony Robbins quote of, like, the pain of staying the same has to be greater than the pain of change. Right. So everything I was doing was the bread and butter and it was the basics. But the pain that I was feeling, the burnout, the unfulfillment, all those feelings, those were only going to get worse if I continued just to do that. Right. And so for me, I hit a point where it was like, something needs to change. I need to do something more, not only for the money and the time, but also just to feel like I'm making a difference. And so that is when the piece of with my mentor. So the way I learned was was lucky, because not everybody gets a mentor. They're not accessible, right? You go to school, everyone say, yeah, find a mentor, find a mentor. You go into the real world, oh, who wants to be my mentor? And all the mentors are busy because they're running practices, they're doing other stuff, right? It's very rare that you get that. So I was honestly learning through, basically through kind of webinars and stuff, but then I had my mentor where I was basically just asking her questions on cases. And so she was helping me on the clinical side, but the actual like implementation side, it was the action. I was just having to try stuff, do stuff. There was no roadmap like, hey, like these are the steps, do them in these orders. I was having to kind of figure that out. And that is where I think when you're starting out, it's a challenge, because it wasn't all roses, right? Because like I would have to figure out, okay, how do we present this? How do we then get the scan? How do we then submit it? All that stuff, modify, but then also making sure that your team is on the same page and your team is doing it. So those are all the things that I had to kind of work through. So it was, to answer your question, how did I learn? And then now what's changed to be able to help? It was very piecemealed and it was very reliant upon me to have to figure it out. What I've now tried to do is I've tried to just simplify that and help doctors, right, in a very step-by-step process. And then, so to go back to your question about also like if someone is coming out and they want to start, what do they do? The first thing is you have to understand that aligners are not cosmetics. They are a tool and a procedure that you can use to improve the oral health of your patient. So that's the first thing that I always tell doctors. It is not about the cosmetics. Don't even talk about the cosmetics. We want to talk about the cosmetics because we like the veneers, the bonding, all that stuff. And we think all of our patients want it. The truth is the average person does not really care about the way their teeth look. They do not. That's in the US, and I know in other countries it's even less, right? Like that's just a fact. So, but what everybody does care about is their oral health. So getting that message across to colleagues is one of the biggest things that can unlock so much, because when you look at it as a tool to help oral health, now it removes this vanity aspect, and it's just like a doctor talking to a patient about how they can improve their health. When you do that, case acceptance goes up. You don't feel like you're selling something that they don't need. You're helping the patient in the long term, right? Decrease the financial investment in having to get, right, perio disease treated, chipped teeth, cracked teeth, all that stuff. And then from there, the next thing that I tell docs is you need to have case selection down. You need to know what is predictable, what is not. So I'll tell you, it's a lot easier to tell me what not to do versus what to do. So things not to do when you start off is class 3 cases. Don't even touch them. Don't try to touch them. Don't try to do it. Refer those. Bilateral posterior crossbites as well. Get those out to the orthodontist. You know, in the beginning when you're starting off, like trying to correct class 2, like AP correction, don't try to do that. It's not that it's not possible. It's just that when you're starting off, it's adding more complexity than what's needed. What else? Those are some of the big things that I would say. You know, anything that's skeletal that's out there, don't try to fix any of that stuff. And then so what that does is it decreases the frame so that your case selection is a lot more streamlined and simple. Because if you're only taking on certain types of cases, then only certain types of problems can actually happen. And so it's limiting all that, right? And so once you have that down, you want to make sure that your first 3 cases are as easy and predictable as possible, because what happens is you build a positive reinforcement loop. And so when you are having success in the early stages with any new procedure, especially aligners, you're way more likely to continue to do it if it's a good result, right? For example, dental school. Let's say first tooth you tried to extract root tip fracture. Okay, now you got to go in and you're digging out this root tip. And let's say you try 2 more after that and it's the same thing. That doctor is probably never going to extract a tooth in the rest of their career because they're just going to be, right, traumatized from that. So what happens is a lot of dentists, they'll start doing aligners, whether it's Invisalign or any of the other brands, and they'll just take a case, they'll scan it because the patient's like, oh, let's do it. They'll scan it, they'll submit it, they'll get a simulation of what's going to happen, and then they'll just click accept, and then they'll put that into the patient's mouths. And then 6 months later, patient has posterior open bite, teeth haven't moved, it's a mess. And now they're like, I don't know what to do. And it's because with any aligner system, you have to modify certain things when the first plan comes back. And that is the biggest thing. Is the disconnect is aligner companies make it seem as though it's as simple as scan, submit, and deliver, when in reality, it's scan, submit, modify, right? Modify the plan, and then you can go and deliver. And so it's that piece that we try to help simplify and teach. Again, I'm not an orthodontist, so I do not teach people how to be orthodontists, but I do help docs do simple, predictable cases while still having the conversation with all qualified patients and then referring the challenging ones. So that's kind of the whole philosophy.
Well, maybe you share just one secret, not all the secrets, because I know you are teaching this, and we
Sure,
will.
sure.
I recommend people booking your course and learning more from you about this. But maybe just a small or two. I have 2 questions.
Yeah.
Question number 1: I mentioned that there are a ton of different aligner companies, aligner systems. The basic concept for me as a I do aligners, but I don't consider myself an experienced aligner user. I have an orthodontist that is consulting me. So if a patient comes and wants an aligner, I do the scanning, I take the pictures, do the x-rays, and then send all this information to my orthodontist.
Right.
And he's a good friend, so he's not even charging for that. Because exactly what you were saying, he tells me, don't touch this. You know what I mean? Or easy case, middle, let's say, yeah, a case you can still do. And I think he's my mentor in that position, that he's saying me, look, this is something where you can do this, and it's a so-called go-to case, easy case, and
Mhm.
the others, I refer them to him being a really experienced orthodontist. And that's why aligner for me is not something that I'm doing every day. If I'm doing it, I'm absolutely with you. Whatever you do, it's like implants. I did my first implant course when I opened my office 35 years ago. I went 2 weeks to Sweden, Brenemark. I had to pay 40,000 Swiss francs for the first implant kit, including 5 implants with a doctor and a nurse assisting you. So, but you were forced by investing 2 weeks training. 40,000 at that time was like 100,000 today, to
Yeah.
just start something that's today, this would be like a big wall. So for a lot of people, I also remember when I started CEREC, you were not allowed to buy a machine without the training. So these
Mm.
walls, they were broken down. So today, implant training, 2 days, 2 hours, 5 minutes. You know what I mean?
Yeah.
And but what what is the small secret, and coming back to my implant journey, I did implants. I stopped because my friends who were implant specialists were telling me, no, Alessandro, this is dangerous. Think about what nerves and vessels and what anatomic structures you can touch, and then your patient will die on the chair. So I stopped doing it and restarted doing implants when I bought 15 years ago my first cone beam CT.
Mm.
If you have a cone beam CT and you do the 3D X-ray, you see all the anatomical structures. I tell my patients now, in this situation, even a chimpanzee can put an implant,
Yeah.
because this is the bone. I have to drill straight here. That's not a challenge anymore. So basically, but it's case selection. And I'm absolutely with you that most of the dentists should be aware of, select the cases according to your skills, and don't try things that you're not able to do. Or
Right.
sometimes dentists tend to do things because they say, oh, wow, this patient wants 10 implants and 20 crowns. This is a big business. I don't want to give this away.
Mm.
But it would be better to give this to a specialist, because otherwise you run into big problems, and
Right.
all the money will not solve the problems. But coming back, what secret can you share with us, that you were telling me, basically scanning, taking the pictures, doing all collecting all the information, submitting the case, let the AI software that all the companies now are using do this setup for you, and then just submit the aligners is not a good thing. So maybe you can give us one or two hints.
Yeah, yeah, for sure. No, I'm happy to. So basically, I think one thing, it can be a secret. I don't know if it qualifies as a secret or not, but it's very similar to what you were saying. This is not surgery. You know, the fear, and this is speaking to the fear a lot of dentists have. Like orthodontics is not surgery, right? We are moving teeth with plastic in the patient's bone. That's it. And we're applying small forces over time. And so those small forces can also be applied in the opposite direction. So if you ever feel like something got moved a little bit too much, you can move it back. Or if it didn't move enough, you can move it again. So that in and of itself it is not some irreversible thing, right? For the most part. Now, a secret. So case selection, I feel like is I'm happy to share that, right? Like what can I do? What should I do? So I would say when you're starting off, taking on cases that have class 1 molar relationship or even class 2, but you're not going to correct the AP positioning, you want to look at the arches. So once you know that you have your relationship, you want to look at your arches. And so you're just looking, is the arch, is it a crowding or is it a spacing? One of the two. If you have like arches, so if you have crowding on the top and crowding on the bottom, that is going to be a predictable case, because the way to solve it is through either expansion or IPR, right? Because when you have crowding, there's not enough space in the arch. That's why the teeth are crowded. And the exact opposite is true through spacing. So again, like arches, whether they're both crowded or they're both spacing, very predictable, simple to do. If you have one arch that's crowded and the other that is not, that is also relatively predictable, because you're only having to address that one arch. When you have unlike arches, so crowding on one and spacing on the other, it's not that it's not treatable, but it's not as simple and easy as the other. So those are some things that I would say would be kind of like yellow flag. Things like even open bites. So anterior open bites with aligners, like those are predictable to do just because of the nature, like in sense of extruding a tooth, right? Grabbing onto a tooth and pulling it down. That movement is actually very predictable. So that's something that, you can achieve with aligners. So those are some of the clinical secrets. I think some more I would even say too is, don't accept the first treatment plan that comes back. You have to do some modification. And another thing that I'm a fan of is molar movement. So moving molars with aligners, it is possible. However, it is not always as predictable as you may think. And so this leads to longer treatment times, right? And more modifications. And so there are plenty dentists and orthodontists who move molars, and I don't knock them. But for me, since I'm hyper focused on helping doctors start, my whole thing is, what are the things that we can eliminate that can cause future problems? And so one of it is just limiting the molar movement. So, in terms of what's predictable, so if you have mandibular molars that are lingually inclined, having to upright them, that is predictable. And you should do that because you're going to gain some space in the arch that way too. Trying to like rotate a maxillary molar, that's going to be more challenging. So I would not recommend diving into those types of movements. If you're going to try to, rotate, there's a movement called a hinge movement. And that's where instead of rotating the whole tooth, you're just kind of hinging it out like a door. So you can achieve a similar result, but in a more predictable way with the aligners. So yeah, those are some, I would say, some early tips that I feel like can help. But the biggest thing is, when you have mentorship or someone in your corner, like everybody has had this in some way, shape, or form, whether it's a specialist, myself, somebody else, it doesn't matter. But like, make sure that you have somebody, but also understand that at the end of the day, you have to be the person to execute. You are the clinician. And so as long as you have someone who has your back, that's good, but you have to also take that leap. And my thing is like, just know, like, aligners it's not surgery. You're not cutting into tissue. You're not having to do something that is irreversible. So take the pressure off. It's going to be okay.
One question. What I see in Switzerland, and not only in Switzerland, is that a lot of orthodontists, at least in the past, they were like taking physical impressions. Today they scan, but they had the two models, upper and lower. They put the two together, look them from all sides. Okay, we need to go into class 1 and all the things we learned at school, the overjet, the overbite and everything. And I see a lot of young patients with a straight smile, not the smile, the natural smile you should have. You know what I mean?
Yep.
Why? So, has this changed when in aligner orthodontics? Because this is something that I'm like saying, why are they just taking the two models and saying, okay, I look at, and there's tissue around the teeth. It's not only the two jaws that are put together. And I remember also in dental schools, they were also always walking around with the upper and lower models, putting them on the table and say, look, now everything is perfect. without putting it into the patient and
Yeah.
say, please smile. And then you see the straight smile looks like a full denture. You know what I mean?
Yeah. Yeah.
And I have a lot of young patients. They have the retainers, they have everything, and then they say they have beautiful teeth, beautiful, no caries, nothing.
But
And then they
flat.
say, yeah, but look, something is wrong. And 90%, I say, look, your problem is that your central incisors are too short in the sense of they have not been placed in. They are straight from canine to canine. It's a straight line,
Yeah, but
and
the
it's not.
laterals need to be slightly above, centrals need to be below,
Yeah,
and yeah.
but what is so? Is this something that is in
That's
Europe?
so, I mean, the only I personally haven't seen it. I mean, in our cases that we do and what we teach is definitely you wanna have you're not having everything flat, right? The laterals are always gonna be about, right, half a millimeter above, so that way you have some I mean, like you said, the natural smile, like, that's proportion-wise, that's what you can control, so I'm not sure, I can't speak on that, I haven't seen it. But yeah, no, that's not, necessarily that's I haven't seen it. But yeah.
Because if you do the standard planning, I think this is not the number one thing that is integrated in the software.
Yeah, no, because that's the thing is the AI is going to try to either they're either gonna try to get arch form, right? Or relation. So it'll just optimize for one or the other. And that's where like you as the clinician, you need to look at it. You know, you need to take your
Yeah.
records, like I said, the photos and see, okay, where does everything line up here? And then you can modify it. That's the beauty is you as the human just need to modify it, which can be
Yeah,
fun.
because the visualization software is also without tissues.
Yeah. Well, now they're improving it to where I mean, it's got the tissue. You
It
can
should
put
be,
it.
there should be like something included where
They
also the
so
patient sees
they have
also the
that.
relation to the lip, not
They
not just not just this fancy animation where the teeth are going into the correct position. You know what I mean?
Yeah, they're
Is
coming
there
out
are there
they have
some are
stuff
there
where
some improvement?
it'll show the smile in the patient's facial profile. So, that's something that, that they're innovating with.
Because I see that recently in the Smile Cloud, which
Mhm.
was acquired from Florin Kofar, which was acquired by Straumann. They presented now this new AI technology where they take the thing and then the patient is even moving and
Yep, yep,
smiling and
yep.
talking with the new teeth. So this could be then something also for aligner treatment or aligner planning to show the patient the final result or the possible result. You have to be
Possible.
careful.
That's true. That's true.
So, because this is also then the legal aspect. So this was a good statement to say we can move forward, we can move backward, we can do corrections. When a patient asks, when is the point to stop? Let's say a patient comes and then they ask, doctor, how long does it take? How long
Yeah,
does the treatment take?
yeah.
And where's the point where you also say, well, oh no, this is going not in the right direction? What are, let's say, the emergency exits or emergency treatments when we are dealing with aligner cases?
So, I always like to set the foundation from the beginning and the frame of, "Hey, we're looking to improve where you are at," right? Improvement is better in my opinion than perfection because perfection doesn't exist. We all have this thing in our head where we believe if you do orthodontics, it's going to be perfection on the other side. It's not. We all have this thing when we do veneers, it's going to be perfection on the other side. It's not. It's improvement. And so what I always tell them, because I made this mistake early, I did not tell them about improvement. I said, "Hey, we're going to make it perfect. It's going to be perfect at the end." First couple patients, it was not perfect. They were not happy. It was a whole mess, and I learned from that, to where it's like, okay, if we just focus on improvement and we say that from the beginning, "Hey, right now, your teeth are in this position. It's causing these problems. We can solve those by improving the position of the teeth so they're in a healthier position." And so that's the goal. We are trying to improve this. So what's nice about that is as long as where you can take them is something that's better than where they were, that is a win, and you can celebrate that. Now, if they want cosmetics, then that is a restorative conversation. That is not an orthodontic conversation because you have more control to customize the aesthetics when you are restoring versus just simply moving, right? Because the shape and look of their teeth are all it's different. And maybe the teeth are in a healthy position, but the aesthetic of it, that's just the way the tooth is. So you can't do anything about that. You can't move it anymore. So I found that if you start with that in mind and that's communicated to the patient, there's not as many needs for exit ramps or aborting, because as long as you have improved, everybody's okay. And then at that point, it's another conversation. Now, let's say it's a case that is, and then if you follow case selection, it all kind of comes together to where you're limiting these issues. The problem is when you don't follow case selection and then you start talking about perfection and over promising and that stuff, well, then, yeah, then you have to have these exit ramps. On the spot right now, I can't really think of any other than having to put your ego aside and admit that, okay, we need to get an orthodontist involved to finish this because I got in over my head. Obviously, this is what you tell yourself. You don't have to tell the patient that. You would just tell the patient, hey, we had a goal in mind. We have been able to take some steps towards it. However, there's some challenges that have come up, and I would much rather get you in the hands of a specialist to be able to complete this so that you get the best result. That's how I would say it.
No, absolutely. Totally agreed. Open communication is the key for success in any situation. Don't try to hide your mistakes. It's better to go straight and say, look, my idea was this, and we are now there. And
Yep.
now I will take care. I will take care of, or I will send you somewhere in my network to really get you to the point that we both are happy. That's,
Yep.
I think this is this is absolutely important. So what would you give as a, to sum up our discussion? What would you give as an advice to young dentists? Maybe in the next episode we will talk. I'm sure, because there's so many things to talk about related to aligners. But to finish up, you struggled. Is a liner, or is your strategy something you can recommend to a young dentist, or is it about finding the passion? Some want to go into surgery, some want to go into orthodontics. So there's plenty of fields. But what made you go to aligners, and if would you motivate young dentists to follow your path?
Yeah, I would say young, middle-aged, old, doesn't matter. I think if you're in a place where you want to expand what you're offering, you want to face a new challenge, face some growth, then yes, you can pick a procedure to do and to follow it and to pursue it. I don't recommend doing multiple at once because you're never going to get good at any of them, right? It's just the power of focus. You pick one, you learn about it, immerse yourself in it, go do it, get the repetition, get the feedback, continue to improve. And then that is how you can skill up and end up becoming very good at that. Now, that opens the door to where you can go as far and as high as you want, or you can get to a place eventually and then where you're like, cool, this is good, this is automated, I want to learn something else. And then you can go and do that. But do not make the mistake of trying to learn everything. So my thing is like, look, if you're in a place where you want to learn a procedure that 80% of your patients can benefit from, it's relatively hands off, you can make some pretty good money with it, and you can actually be a part of a transformation, I would recommend you do aligners, and as you said before, also, like, we've got paid courses. We also have free trainings. So wherever you're at, it's the
Well, I
whole.
think your free trainings for sure can give an idea
Oh
to
yeah.
people and then decide if they want to dive deeper. So I think this would be, from my side, a good closing remark, how to handle the situation. And it's good to have people like you that support us. And I think you will become a mentor very soon if you're not already are mentoring the, as you mentioned, also younger, middle-aged, older dentists. Even older dentists should think of maybe change something even at the end of their career, because it's like, oh no, I will stop in 5 years, or I will stop in 10 years. Why should I change anything, even if it's boring? And I think fresh ideas help us. Not only, it's not always about money, it's about having more fun, more love for what you're doing, and a happier life is, I think, as important as the success money wise. So
I agree.
that's great. That's great. And I really appreciate you taking your time. I think it's early in the morning for you, or yeah, or what time is it
Yeah,
now?
it's 9 o'clock right now in the morning. It's not too bad.
Oh, okay. So
I've been
it's
up since 5 o'clock, so it's all
okay,
good.
cool. So it's almost middle in the day for you.
Yep,
So,
yep.
Avi, thank you very much for taking your time. And I'm sure we'll talk again soon because I still have a lot of questions to ask to you, and I will follow you. And yeah, maybe always also take a webinar to learn more about aligners, because it's really a fascinating topic with a lot of fine tweaks and ideas that are important, and never stop learning. That's what I always say to anyone listening out there. Never stop learning. Always stay curious like a child. That's also a saying. And thank you, Avi. Wishing you a great weekend ahead. And yeah, talk to you soon. And for all out there, don't forget to hit the subscribe button to watch also. Avi Patel is on YouTube and on Instagram and on all social media. So if you want to learn more, we will add also the link to your courses in the description of the video for all who wants to learn more, to see more, to explore more. And yeah, see you soon. Talk to you soon. And thanks again, Avi, for taking your time.
Awesome. Thanks so much for having me. I really enjoyed it.